So I was thinking about nurse vacancies in the NHS in England today. Last year it was reported there was over 40,000 nursing vacancies in the first quarter. Research has already looked at overcoming this gap, and as it's already been mentioned, a quarter of the workforce is research practitioners. So the workforce has diversified and it continues to. I'm not talking about practitioners working in silos and working on their own, and I guess it's different, as Imogen said, in mental health teams, but working together as nurses and with other health professionals to make a really cohesive and talented multidisciplinary research team. I loved finding my feet in my first research job. I worked as a research administrator for an oncology team in Bradford. But although I felt well supported, I felt there was a lack of opportunity for me to progress in this role, and I didn't feel like it was something I'd be able to stay working in. Fast forward a few years and this has changed. I now manage a team of 9 people working in Whittington Hospital in North London. This is a mix of practitioners, health visitors, nurses, midwives, and I can only do this with the support of the people around me, the people in the team being keen and eager, and with the help of the clinical and non-clinical staff that work together in a multidisciplinary team. So developments have happened in research delivery roles, but they're continuing to happen, and we can only build robust teams if we continue with something that can help retain the staff in these areas. There's an increasing number of studies that are increasingly more complex, and for us to be able to meet this demand, teams need to further diversify. Angarad and Imogen both touched on this, but the register will give us some identity and ownership of the workforce, and also that people are appreciative and they recognise that these people are out doing these jobs, and it just formalises the process. And to standardise the competences, to have something that's equal across trusts and across the UK will really help, because at the moment you go from one trust to another trust within the same region, it's totally different. So I think the register will help retain keen and eager staff. It will give reassurance to managers, to industry, most importantly to patients, that the people delivering the studies are qualified, competent and skilled to work within a multidisciplinary team. Okay, so I'm going to wrap up by asking you all to just consider this as the day goes on. So the success of this relies on all of us and what we all put into it. So where do you all fit into this? Where can you promote the register to make sure it's a success, to improve delivery for the benefit of all of us and for all patients? Thank you.
Thank you.